My name is Zakia Rahman. I also go by Zach, and I am a clinical professor of dermatology at Stanford Medicine. I like to say I wear many hats, but they're all wide-brimmed. I direct the resident laser and aesthetic clinic at Stanford, and I also co-direct dermatologic surgery at the Veterans Hospital. So we see a lot of skin cancer patients, and I would say that my passion is lasers and energy-based devices that we can use for medical as well as cosmetic indications. I have conducted a number of studies looking at different laser devices for precancers. We also had done a longitudinal study at the Veterans Hospital looking at a topical formulation of FUDEX that actually reduced the incidence of non-melanoma skin cancer, specifically squamous cell cancer. One of the things that I see often on social media is that people have 40-step skin routine. And I think what I always try to stress with my patients is that this shouldn't be something that's a burden. If you really enjoy doing that, great, more power to you. But most of us are relatively busy. And so we want the simple things that I think are most important. And I would say that with sun protection, which we know that ultraviolet light radiation is a carcinogen. So we know that for a fact. Although I'm not telling people to go live in a cave, I love the sun. I love being out in the sun. There would be no life on Earth without the sun. But it's just getting sun exposure in a way that is helpful and useful. And one of the things we get from sun is vitamin D. So no matter what, I always recommend either getting a vitamin D check or taking vitamin D supplements. Easiest way to get it is in your food, so foods fortified with vitamin D, or taking a vitamin D supplement every day. But as far as sun protection, I would say that your sunblock or sunscreen should be the last step in your regimen. So if you're washing your face, you're getting out of the shower, you apply a moisturizer, then maybe you'd apply a number of other topicals or maybe makeup, and then on top of that, you can apply your sunscreen. One of the things that people don't understand is that if your makeup or your product or a cream has an SPF in it, it's not additive. So if I put something on that's an SPF 15 and then I put another SPF 15 on top of that, I'm not getting an SPF 30. It's about average. SPF 15 actually gives you 94% protection from the sun's rays. So it's not a linear, it's actually logarithmic. And then that goes up to about 98% with an SPF 30 and then sort of plateaus out. But the reason that most dermatologists recommend SPF 30 is when you look at how much people apply to get that SPF rating, people are putting about 1/3 to 2/3 of the amount they need. So when you're applying an SPF 30, you're probably getting an SPF 15. One of the real positive things is that women are really the stewards of health for themselves and the people around them. So in families or in connections, women actually improve the health of everyone around them. And so I think a lot of times the women who, take care of themselves will also recommend the application of sunscreen to whoever is in their life. But I think that awareness and taking care of oneself is something that maybe women end up neglecting, right? We're so focused on taking care of others. So it's important to kind of take care of yourself. And maybe a nice skincare routine where you're applying a moisturizer, then you're applying a vitamin C and then a sunblock. I kind of see it in the morning as sort of a little self-care ritual. So I'll apply and then I'll kind of just put it on my face and going up. And it gives me just 5 minutes of kind of like a relaxation and stress relief and a slow way to start the day. In the evening, what I recommend is washing the face and then applying a moisturizer. I like hyaluronic acid ones because hyaluronic acid kind of plumps up the skin and it can temporarily plump it. So it retains the water and moisture in our skin. And then I apply a vitamin C with dimethicone. And that also acts like a sealant and a humectant. And vitamin C is not only a potent antioxidant, but it's essentially an essential cofactor for our body to make collagen. And then I apply a topical retinoid. And by stacking, it actually makes it much more tolerable. And we know that retinoids have not only beneficial properties in terms of aesthetics, like wrinkle prevention, treatment and prevention of scarring, but they also treat and prevent acne and sun damage. So they help reverse a lot of the sun damage. So I think that's also a critical part of what you do at night and then what you do in the day when you're preparing to be in the sun. There are patients who had some really significant side effects of new advanced cancer therapies that are life-saving. So these therapies allow people to live for years. with really advanced cancers. But some of the side effects are that they get a real significant eruptions, like an acne eruption that they get, and it's really itchy and irritating. Some patients also get excessive hair growth. And so I worked with my colleagues in supportive dermato-oncology, which is to basically help those patients who have those side effects from cancer therapies. And we said, let's add on some of the things we do. So we started treating those patients with lasers that would target some of the red and the acne, lasers that would reduce hair growth. And thankfully, this is a program that we've continued to build up. So our program is called Restorative Dermato-Oncology. Some patients get pigmentation after their cancer therapies. And I love to see these patients because I think, it's such an incredible journey that they've gone through, having cancer, surviving, but then they want to look better. And certainly we want to not have them see the sequelae of their cancer therapies. So that's something that it's near and dear to my heart. As the weather gets a little bit cooler and rainier or overcast, I think it is important to know that the clouds don't filter out all of the UV damage. So it is important to use sun protection. And then to know that regular glass doesn't block out ultraviolet light A. In the United States, by law, all windshields are required to have extra UVA protection, but the side mirrors are not. And actually, this has been published in studies since the 80s that people are more likely to get skin cancer on the left side of their face because that's the driving side. So I think it is just important to know that we have definitely many different ways that we can get that UV exposure. So important to really sun protect even in those kind of environments. You can actually get UV tinting, and you can get it so it doesn't actually darken inside of your car. So that's something that, I give letters to my patients, although I've been hearing more and more that people can actually just get the tinting and they don't need a doctor's letter. But if you feel like you need a doctor's letter, dermatologists are happy to provide that if there's any laws about tinting of windows. So one of the benefits with a little bit higher SPF is that you can leave it for a little bit longer before reapplying. The FDA has some new guidance that's come out around what's called GRACE, so generally considered safe and effective. And they only put the sunblock, so titanium and zinc, in that category. But one of the issues with that is they kind of look sort of whitish on a lot of skin, certainly my skin tone, and then a lot of patients who may have even darker skin tone. And they do have some tint in them. But just to be aware that if you wear that it has a lower risk of endocrine disruption, but you can also wear sun protective clothing. So what I'll do is I have a series of sun protective shirts and jackets. And so no matter what I'm wearing underneath, I'll rotate those. I'll wear driving gloves when I'm driving. So I feel like it's something I picked up when I went to Japan, and I thought, brilliant, driving gloves. So I thought, I want my hands to look good. Mm-hmm. So it's a little bit of vanity, and it's a little bit of prevention of skin cancer too. And it turns out that people are motivated by the desire to look good, and it's prevention of skin cancer is an added benefit. And I think it's a win-win. Physicians, we're always trying to find ways to help motivate our patients and work collaboratively with them to have healthy habits. And so it's, the doctor-patient relationship isn't such that I can go in and say, do this, this, and this, and then walk out of the room. I have to find a way to develop a relationship with the patient and convince them that, hey, this is something that you should do. And I think one of the ways that I do that is say, well, actually using sunscreen and sun protective clothing will actually prevent the premature aging of your skin. And the added bonus is it will reduce your chances of getting skin cancer. So I think framing it that way works well. This year, I joined the faculty at the Stanford Center on Longevity, which Laura Carstensen and Deb Cotto co-direct. And so, what they'll say is that since Homo sapiens have walked the earth, this is the greatest increase in human life expectancy. So we have about 30 extra years. So people are living a lot longer, and especially women are living a lot longer. And, we tend to outlive men really at every decade of life. So I think a lot of these, take care of yourself, look your best, and be vital, I think is important, because we want people as they age to be vital members of the community. I think it's beneficial for them, their psyche, and it's beneficial for society as a whole.